Hi people, you're welcome to another edition of MAXI Health, where your health comes first. This package promises to be very exciting because it is fully loaded. We have your doctor's perspective, Ask Your Doctor segment, and at the same time we'll be bringing to you documentary on prostate enlargement. Please sit back, the program returns shortly. My name is Dr. Margaret. Welcome back. If you're just joining us, you're still watching MAXI Health, where your health comes first. And this is the Doctor's Perspective segment of the program. Today on the Doctor's Perspective segment, I'll be talking secondary infertility. This is very important because for a lot of men and women out there, once they've had 2 children in the past, they feel it should continue that way. Yes, normally it should continue that way. But there are times in our lives that 1 or 2 hindrances might have come into place, and then there's a form of delay. And that's why today I'll be talking secondary infertility. Now, what's the definition of secondary infertility? Secondary infertility is defined as the inability to conceive or carry a pregnancy to term after you have already successfully given birth to 1 or more children. Many couples experience secondary infertility even after easily conceiving and carrying an earlier pregnancy to term. A lot of people believe once you have had a child, you can never have problem conceiving again. This is not true because secondary infertility is so common and it accounts for up to 60% of infertility cases. That's the truth. I've seen a lot of couples come down and complain, doctor, when I was in secondary school, I was able to pregnant lady A, lady B. In fact, I was able to pregnant like 10 ladies. But right now I'm married and the pregnancy is not coming. Why? That means it's my wife that has the problem. No. It might even be you that has the problem. And you see some ladies too. While I was in secondary school, while I was in university, I've had a lot of pregnancy and I had to go and do abortion. But right now, the pregnancy is not coming. And meanwhile, there are some people also that even they are married, they've had 1 child, they've had 2 children, they want to have more, but the pregnancy is not coming. What are the reasons? There are different things that could cause this delay. And that's the meaning of secondary, when you have been able to have 1 or 2 successfully without any problem. But right now you want to have other children, but it's not coming. Now, what are the major causes? The first major cause I would like to mention today is problems with erection or ejaculation. 2, problems with the semen, such as men that have low sperm counts. Yeah, when a man has low sperm counts, you might probably like 5 years ago, you used to have a good sperm count. And all of a sudden, right now, you are having a low sperm count. It's very possible, which could happen as a result of probably, maybe there's been a problem with your semen, probably maybe you have an infection, or you had a problem with your sperm ducts, or maybe you take too much of alcohol, or probably maybe driving long distance, or probably maybe even placing the laptop on your laps, or even at the same time, maybe you wear tight pants. These are things that can lead to low sperm counts. You understand? That is all I have for you today on the Doctor's Perspective segment of the program. Please stay tuned. The program continues shortly.
For sponsorship and advert placement, please contact Bimbo on 0807 176 7592 or 0803 778 3305.
If you're just joining us, you're still watching MAXI Health, where your health comes first. And this is the Ask Your Doctor part of the program. On this segment, what we do is we receive your emails, text messages you've sent to us, and give you answers to them. My first question this week says,
Doctor, I have breast milk flowing out of my breast. I have not given birth. I have run a test on this, and the doctor said it wasn't an infection. Please, what do I do to stop it?
Okay, basically, yes, that's not an infection. It is what we call hormonal imbalance. It's as a result of your prolactin level being on the high side. Okay, since you've done a test, I would advise that you pick my number on the screen and give me a call. All we have to do is we reduce your prolactin. Once that is done, the discharge from your the breast, the milk that is coming out from your breast is stopped, and then you continue to live your life healthy.
For some time now, I have been experiencing low flow of my period and dark in color. What should I do?
Okay, basically, if you're experiencing that, that means you have come in contact with an infection. But the type of infection is what we don't know, and that is why your period is dark in color and the flow is scanty. So what I advise you to do is get to the laboratory and run a swab culture test and a urine culture test. When your result is out, you can call the number on the screen.
Good day, doctor. My problem is that something dirty and odorless is always coming out from my private part, and my private is itching. What do I do?
Basically, as a lady, it's very important that we keep our private area very clean. You see, that's why everything that she has mentioned now is as a result of infection. It is itchy, it has odor, it is dirty, you understand? But you know, a lot of us, once we're experiencing things like this, we just feel it's a normal thing, but it's not normal. It is when we get married and once we start bearing children that we now find out we have this delay in conception, because once we come in contact with an infection, it stops the ovulation automatically. Once there's no ovulation, there can't be pregnancy. So my dear, immediately you notice one or two, or if I don't, it doesn't have to get to two. Once you notice one form of discomfort in your body system, immediately do what? Try and get in touch with a doctor. Once you get in touch with the doctor, give the complaint to the doctor can tell you the right thing to do. But now what I would advise you to do, my dear lady, is get to the laboratory and run a swab culture test also and a urine culture test.
Doctor, each time I have intercourse with my husband, my abdomen will hurt seriously till he stops. What will I do?
Okay, basically, when you're meeting with your partner and your abdomen is paining you, hurts you seriously, well, that's a very funny question. But at the same time, is it that you have hotness? Because a lot of women will complain after intercourse they experience hotness in their tummy or at their lower abdomen. I think I would advise you that immediately you get my reply to this, get to the laboratory or see a doctor, run what we call a pelvic scan test. Let's be sure you don't have what we call pelvic inflammatory disease. Now, once you're sure of this, you understand, and then you can now know what else to do. But if you have a pelvic inflammatory disease, then it's advisable that it is treated. But first and foremost, get to the laboratory and run a pelvic scan test. Then this can ascertain to us where and what exactly the problem is.
Good morning, doctor. I have a problem that is bothering me. My period comes 2 times in a month. What will I do?
Yeah, it could be normal. It depends. Now, when I say it could be normal is that different ladies and their different types of cycle. If you are a lady and you have a cycle as short as 21, normally you will be seeing your period at least 2 times. But if you have a constant cycle of probably 28, then you should see your menses at least once in a month. So it depends. You have to be very sure of the kind of body you have. If you have a short cycle, the probability of you seeing your period 2 times in a month is there. But if you have a long cycle of the normal cycle of 28, then at least once in 1 month, then you should see your cycle. But if you're not going through any of these and you're still seeing your period 2 times in a month, then there's a call for concern. So what I would advise you to do is pick the number on the screen. Let's talk one-on-one. That is how much we can take today on the Ask Your Doctor part of the program. Please keep these questions coming in because people are benefiting from them. Please stay tuned. The program returns shortly. This is still MAXI Health, where your health comes first. We'll bring it to you right now, our documentary on prostate enlargement. Please stay tuned and enjoy.
As a man ages, his prostate enlarges with benign or non-cancerous tissue, also referred to as benign prostatic hyperplasia, BPH for short. Prostate enlargement, however, is a common illness which affects mainly men due to their biological composition or makeup.
Prostate enlargement has some level of heredity involved, which can be inherited from the father and maybe somewhat along the family line.
That means if your father have it, the son is likely to have it, the son's son is likely to have it, so it runs in the family.
Both prostate enlargement and prostate cancer, the cells respond almost equally to testosterone by growing abnormally. Now, when we say cancer, it's just an abnormal growth, of the normal cells.
Medically, what really is prostate enlargement and its related disorders?
When we talk of prostate, we are talking of a gland that is found only in men. And this gland is located at the base of the urinary bladder or at the outlet where the urethra, which urine passes out to the penis, is located.
Prostate enlargement is a common problem that faces men as they age, above the age of 35 years.
The testis produces a hormone which is called testosterone. It is a male hormone, and this testosterone is produced under the influence of the brain, and this has a relay effect. And as these chemicals are acting on the prostate or the testis, they produce testosterone, and this testosterone with time is like a fuel actually for the prostate gland. And therefore, as we continue to age under the influence of this testosterone, the prostate organ or gland always becomes bigger. Because the prostate is enlarged, it tends to block the passage from which the urine will come through the penis. And so you have to strain before the urine comes. And when you are straining, the pressure with which the urine comes also is weak. It doesn't come with that force. It comes slowly, and then it tends to also to break as the urine is flowing. Advise that all men above 50 years should have prostate examination at least every 6 months.
Is prostate enlargement treatable, preventable, or curable?
If we find it early, we are about 90% cure rate. But if it becomes cancerous, unfortunately, for the current time, there's no cure. There are the orthodox way of treating, and there are herbal way of treating. The orthodox way, there are various means. You can intervene by giving tablets or injections if they need be. The herbal methods are that we give herbal medicine that will shrink the size of the prostate back to normal.